This podcast series is made possible thanks to the generous support of the Patient Care Foundation. The Patient Care Foundation supports medical students in need through scholarships. Each year, the Patient Care Foundation changes lives by giving deserving medical students facing incredible odds funds to continue their education, resources as they deal with food, housing and transportation insecurities, or other challenges in the wake of COVID-19. Thanks to Dr. Troy Elander, chairman of the Patient Care Foundation, and Elizabeth Kurohara, board member, for their support. To learn how you can make a difference for a young medical student, visit ladocs.org, click Advocacy, and click Patient Care Foundation. Welcome to this edition of Clear as Mud, the podcast dedicated to bringing clarity to medicine. I'm your host for this episode, Gustavo Friedrichsen. Our next topic is about when pandemic intersects with burnout. Our guest is Dr. Dave Logan, CEO of CMA Wellness, part of CMA's effort to address burnout. Before joining CMA Wellness, Dr. Logan served as Chief Transformation and Innovation Officer for P3 Health Partners, a population health management organization focused on improving patient outcomes through value-based care. He was the co-founder and Senior Partner of CultureSync, a management consulting firm that creates high performance through an alignment of strategy, structure, systems, and culture, and has been on the faculty at the University of Southern California since 1996, teaching in the Executive MBA, Executive Master of Leadership, and Master of Medical Management programs. He holds a Ph.D. in Organizational Communication from the Annenberg School at USC. Dr. Logan, welcome to Clear as Mud.
Thank you, Gustavo. As my late mother, though, would say, I'm not a real doctor, so please call me Dave.
Thank you, Dave. Appreciate you and everything you're doing. So as CEO of CMA Wellness, you face a daunting task of addressing burnout in medicine. What did you see as some of the sobering trends before the pandemic even hit?
Oh, well, first of all, Gustavo, thank you for what you're doing, and it's an honor to be among your first guests here. In answer to your question, it's awful. And it's awful because we have to use the present tense of something that most of us are used to thinking about in times of war, like World War II. Doctors are being traumatized. And it's important to note that in this age of diversity, equity, and inclusion, several people have told me you can't just talk about doctors, or you can't just talk about physicians. You have to talk about NPs, you have to talk about RNs, you have to talk about PAs, and you can't just talk about clinicians. It's about all of us. About 35% of the practices that closed during shelter in place are still closed. And I was doing a telemedicine visit with this great allergist, and it was over Zoom, and I just stopped and I said, how are you? And he kicked his MA off the phone, and he said, I don't know what I'm going to do. Like, I'm getting paid, I'm not going to repeat the amount of money, to do a 30-minute visit. He said, we haven't furloughed staff, but we might. I don't know whether to quit. It's awful. The fact that he could, then he started to cry. So what's happening right now is just awful. So I hope that long rambling answer came close to answering your question.
No, it does. It gives us perspective, and it gives us a starting point for a series of other questions. Based on that, and based on what you're hearing every day, what you've been seeing for many months and over the course of your career, what are you working on now that's exciting? And what are you working on now, or have you been developing that you want physicians to know? So there is a glimmer of hope. There is a light at the end of the tunnel. There are some resources they can point to with the CMA Wellness program that you've launched.
We've had to make more decisions in a few months than we probably had expected to make in a decade. And so what we've had to do is fundamentally reinvent the model. And I really want to thank Dustin, the CEO of CMA, for being one of the visionaries on this. We are essentially, and actually it's done now. We've created an online university. We call it Wellness University, but it's not trademarked or anything like that. It's just what we call it. And so we're now offering virtually things that you would take at a university. And so the obvious thing that we're teaching is leadership, because leadership does have an inoculating effect to burnout. And when you train people to be leaders in their own life, it's pretty hard to do that and be burned out. It's also really hard to be a leader who is burning other people out, because then the people around you aren't functional. We're also doing, if you think of sort of like electives at a university, right? Take an elective class. And so one of the major electives that we're offering right now is a program in organizational transformation, where we would go into a system and get especially the leaders of the clinicians, which do tend to be the physicians, to see that the status quo is not just unacceptable, it is disgusting. Like, to create a visceral sense of being upset about where things are going, and then moving to a new vision and then really putting that vision in charge so that it's not just the C-suite of the organization that's in charge, but the vision. And such a key part to this, Gustavo, as you know, as I've seen you do exactly what I'm about to describe, is making sure that everybody has a voice in that. And the voice, obviously, at the California Medical Association, we want to start with, the people that we are charged to serve, is the physicians. Diversity, equity, and inclusion, that stuff's not optional anymore.
No, Dave, I mean, that's why I appreciate you and what you're trying to do and what you've been building, because you're trying to change not just an industry, you're trying to change a profession, an industry, but society at the same time. Anything you want to add about what's in store or tangibly what you think doctors and the profession needs to know? Because we're going to keep having these conversations, especially, Dave, as you go down the road of creating a different culture within this industry. Love to talk to you more about that at the end of the year, beginning of next year. But what are things you want doctors to know right now about what's coming up?
One thing that I didn't mention, but you want to go back to the start of the pandemic. And again, we saw it coming. And so we had a head start. And so we put together 2 plans, and it got titled Care for Caregivers. And the first part of the plan was hotel rooms for caregivers, because we read stories of not just doctors, but nurses sleeping in tents because they didn't want to infect their families. We partnered with the nurses and SEIU. It really was a joint effort, but we were really pleased when Governor Newsom enacted that program, and he called it Care for Caregivers. But what not a lot of people know is there was a part B, part 2 to that same plan, and that was mental health. And that part did not get funded. We still hope that it will, but while we're waiting, we can't wait because the need is acute. So on our own dime, we took a huge leap of faith, and we developed a big technology infrastructure and a training program. It's like an all-volunteer army. And that program is called Care for Caregivers Now. And it's a program of peer coaching. The people who provide coaches are doctors and nurses. So I would not be eligible to be one. They're all doctors and nurses. Many of them are retired. And we've taken them through a coaching process. But we had certified coaches, I'm a certified coach, sign off on them saying, yes, this person can represent our program to provide any sort of need. And it's not just, my life is falling apart because of COVID, or I'm dealing with financial stress. It could even be, I'm not even sure what I need. Coaching is a safe space to talk about anything. Now, there are rules, of course, if someone, says that they're going to hurt themselves or others, but that actually comes up in coaching. So our program is actually anonymous. You don't actually know who you're coaching. They could have put in a fake name. So that's a long way of saying what I would encourage every single person to do. Go to this website, caregiversnow.org. And there are 2 places you can go. And one says, is you're a caregiver and you'd like to receive coaching? Remember, it's all confidential. No money is being exchanged. And go on and seek that, because that's going to be an opportunity for someone who's been trained to reach out to you for as long as you want. I would really encourage everyone to do that.
Dave, this is fantastic. Great work. I don't call it a program or an initiative. This is a transformative sort of process you're on, this journey that you're on. Appreciate you. Thanks for joining us today. We're going to have you back probably multiple times. Love to have you and your team back. Love to just keep getting your wisdom into this conversation. Appreciate your time. I know I've been saying this to a few folks, but truly on behalf of our 7,000 members and our board and our executive committee and the entire LACMA family, thank you for what you're doing. And be safe. And remember, Clear as Mud is about bringing clarity to medicine. You're definitely bringing clarity to medicine. So thanks, Dave. Appreciate you.
Thank you.
Thanks, Dr. Logan. We hope we've shed some light on how COVID has impacted physicians and shared resources for members going forward. We want to hear from you. Ultimately, this show will evolve as medicine does every day. What topics should we cover? Who would be ideal guests? To learn more, download expanded commentary or tap into resources to help you thrive now and in the future by visiting ladocs.org. That's ladocs.org. Many thanks to our sponsor, the Patient Care Foundation, for their generosity, and our production team of Gabe, Mike, and Dennis. Thanks for listening to Clear as Mud. Be safe.